It keeps popping in and out. Is he having problems with
He's
technology?
having problem, so he's calling me to fix up the problem. So he wanted to join the show, but he's having some difficulties.
Because this is a good conversation for David as well, because
Yeah, that's true.
it's
Yeah.
very, very
I'll
good
try
conversation.
one more time. I'll just go out and try one more time. In the meantime, we should
Okay.
welcome Dr. Rajat Gupta. He's a pain specialist based out of Delhi, and he'll introduce himself. I'll take a leave for the meantime.
That sounds good. Um,
Hello, everyone.
hello, namaste.
Hi.
Namaste.
Good evening to you.
Good evening.
It's
Good morning to you.
Oh, thank you. Well, we're almost noon. We're past noon, so it's our days change. You know, Aunt Kit and I do this for 4 hours every day, 7 days a week. We felt the passion to get the word out to people from all of these your intelligent experiences of how we can not just win the war of COVID, but for the future, right? That we these are things we're not just building for today, we want to establish these things for the future. So, how are things going for you today?
Things are going good. We are doing well. The people in India, though the numbers are increasing, but we guys are fighting out, and we are very positive, and we are trying to find out vaccine and different solutions to the disease. So hopefully, we'll be able to get a control on that.
You know, we've been talking about a vaccine. China claims they have a vaccine, and we've been working with Dr. Yu. He's been on our show. He comes on 3 days a week. He does stem cell research, and there's another doctor, Dr. Stein, that's in Vegas, and he's doing stem cell research, which seems to be a healthy alternative for vaccines if we can make it work. There's a lot of controversy with stem cell, but I've learned a lot through them that they're not just taking stem cells from anywhere. And they're very, very healthy and mindful about the use of stem cells. Um, so, very interesting research. They use stem cells right now for pain. You know, that they're just generally taking good, healthy cells, and if they can find the right receptor in the body, they can put that healthy cell in the body and let it regenerate what has been damaged, because that's what our cells do, right? Until eventually they don't have the immunity to do that anymore until we get older. Those cells get older, and so I've learned a lot watching that. What are some of the experiences? You said that you're seeing an increase of the infections
The
in.
whole idea behind this
So, link. So,
I think we're having some difficulties.
not audible.
So, well, in infectious disease, what is your thoughts on, Dr. Hoju? What is your thoughts on stem cell research?
Already, I think 2 days back we were with Dr. Philip. I think or Philip Yu. He was already on the a lot of research. He has already did it on this topic. Even the one of these research is going on with help of Israel and I think some hospital in New Jersey. I think they were on the uh, PLX, I think plaque cells. It's a kind of a extract derived from the placenta, and those are the cells which are pluripotent. Means they have the capability to convert into any active cells, any kind of active cells, and those have the capability as to act as an immunomodulator, just like our hydroxychloroquine, which we say it's an immunomodulator. It's an anti-malarial drug, but by an immunomodulator, it can help in controlling the virus part. Similarly, with the PLX cells, whatever we call the pluripotent cells, they can be acting as immunomodulator. Also, they have been using it. We have been using it earlier also for the regeneration tissue, for regenerating the tissues like any chronic insufficiency in the lower limb or any kind of dead muscle regeneration. So those are the things we have been used in the past in terms of regeneration of the tissues. But to tackle this virus, I think it will be a new venture for us, and hopefully if it comes out to be successful, that will be the winning part of the whole humanity. It can be utilized because company has already claimed that even if it comes out to be trial comes out to be successful, we'll be producing a lot of PLX cells that can be used both in the Western world as well as in the Asian countries also.
And I agree with you. And my whole thing too is some of the stuff in research of stem cells is why not utilize things that are already in our bodies and in our DNA rather than creating something that is of a foreign substance to the human body. To recreate it and help it rebuild and become healthier, just like when we're putting healthier foods in our body, right?
Yeah.
And I'm going to be drinking a lot of turmeric. Ankit tells me this all the
Yeah.
time, and we've got a lot of input on that. I think I'm going to start selling it. It's, but all of these things are healthy. Some of the things that we've been talking about is the mental state of mind. We talked about that today, which I think is very important. And when you're fighting any kind of disease, infection, viruses, pain, Dr. Gupta, I think people need to be in the right mental frame of mind when they're in pain. I know I learned a lot by going to a pain psychiatrist years ago to help learn to live with my disease. Because you have a tendency when you have a chronic disease to sometimes get depressed. You're not feeling good. You're not sleeping good. You don't sleep good. All of these things happen. But when you have knowledge, you have no more fear, and you know how to fight. But knowledge comes also with strength up here. What are some of the things that you're seeing with the climb of the infectious rates in India, Dr. Gupta? Are you seeing some of the pain?
Yeah, we have been seeing a lot of patients with cancer pain. So chronic pain patients are not regularly following up because of the scare of COVID, but cancer pain patients have to follow up for their opioids refill. So we are seeing a huge number of cancer pain patients coming in. These patients are already very depressed and they are fighting with a tough disease. So probably COVID is not affecting them that much. But yes, we are trying to encourage them, motivate them, and tell them not to worry. And coming back to COVID, and so there has been a lot of research into plasma cell therapy.
Awesome.
So they are taking plasma cells from the patients who have recovered from COVID, and they are said to have rich in antibodies against the COVID virus. And they are trying to transfuse that into patients who are terminally ill with COVID-19. And we have been doing few cases and have got very good positive results. So let's hope that this plasma cell therapy is also a boom to treat COVID patients.
Awesome. Where are they obtaining? I mean, this would require a high dose of plasma. How are they obtaining all the plasma right now?
So they are targeting the patients who have recovered from COVID-19 and
Awesome.
have been discharged home. And they are encouraging them to come back to the hospital, donate blood. They are collecting the plasma out of that blood and retransfusing the blood back into the bodies, and then transfusing that plasma onto the patients who are on ventilators or critically ill. And there are 5-7 cases which we have done so far, and we have seen good positive results. These patients are recovering.
Wow, that is such good news because that's a good solution. That seems to be an easy
Yeah.
solution.
And they say that this has been tried in the past also for Ebola virus and
Yeah.
polio and other various viruses. So probably the old therapy is working. So let's hope. Let's keep our fingers crossed.
So, Dr. Gupta, is that means that the therapy works for all the patients, or is there any bifurcation based on the plasma therapy?
Ankit, it is still very, very fresh. Cannot comment whether it's going to work for all the patients. So far, we have tried it on 5-7 patients. They have recovered. But once we get the okay from the central government and we try it on more number of patients, then we'll get to know about the failures and success.
I would also like to take a view from Dr. Jatin as well regarding the plasma therapy. So, Dr. Jatin, what do you think about the plasma therapy, and what kind of treatment we are seeing in future using plasma?
Yes, I think the even the Delhi government has started this initiative in terms of from the social media also and from the television part also, that more and more people who have been recovered from the this COVID-19, they should come out, and even the government will help them, will facilitate them to come from their home to come to the hospitals, give their blood. That blood can be utilized, if the depending upon the antibody titers, if they're high, they can be utilized from for two patients for the recovery. If the antibody levels are not so much high, at least, in fact, adequate also, that can be utilized for the this one person life saving can be done. So convalescent plasma, any patient who has recovered, who has no fever, 2 weeks have been passed, patient has already mount the IgG antibody response, and he's totally afebrile. Those are the persons. Our role is to promote them, to educate them that yes, you are totally healthy, and now there will be no problem if you come out and give your blood. That blood can help us in treating many patients. So even not about research, we can save life, we can do research, but it's a humanity work. It's a humanity, because if people who have recovered, they have the good immunity, and they can give their blood. There's no harm in giving blood. I mean, everyone should give blood after every 3 months. I mean, that's the whole concept. There is no doubt about it, whether you are COVID positive or COVID negative. But yes, if you are COVID positive earlier, you have recovered, then you can save life in terms of for those who are severe COVID pneumonia patients. So in India, I think this is the new concept which is going on already. Western world has tried, and some sort of even success has already been received. In India, we have treated 5 patients so far, 5, 6 patients. The results are really good in terms of that. Second thing is those patients who are coming in contact, they will also mount some herd immunity also. So to what about the ending of this COVID-19? So we see ending of this COVID-19 pandemic by 3 ways only. One is by development of the herd immunity. Second is those who are having comorbidity, so they should receive convalescent plasma. And third, which is a remote possibility so far from now, that is the development of the good adequate vaccine. So only these three are the measures, I think, by which any country will come out of this pandemic.
And also, I mean, what our viewers would like to know, is plasma therapy a painful therapy for them, or is it as same as the other therapies, Dr. Rajat?
It's like blood donation. There is
Okay.
there is nothing. So there is no scare or anything. It's
Okay.
like donating one whack of blood. So that's all.
That's
Is
it.
it
And
like,
how much blood?
is it like a dialysis treatment where we just take a blood out and then put in from? Is it
Ankit,
like
that
that?
seems that you have never donated blood.
No, no.
Blood
I have
transfusion.
done it. I'm just trying to explain for my viewers. I mean, what happened with the
No,
vein.
it's like blood donation. You put in a cannula and
Okay.
you just put in a drip. You take out blood and you transfuse it back. That's all. So you have
Okay.
cannula in. That's a single prick. That's it.
I'm just curious about, is it taking just one transfusion, one bag, or I mean, how much is it taking to help the patients?
So 1 unit of blood will be sufficient to from 1 unit of blood, whole blood. What they do is they extract the plasma part, and
Okay.
the rest of the blood, if required, can be given for as a packed RBCs for any other patient. But for plasma part, we extract it from the segregating machine, and then that can be given to the desired patient.
Okay.
And also, if something is, I mean, if that the other person is suffering from some kind of a disease, or maybe something like diabetes or any chronic disease, would that also carry forward to that other person? Or I mean, is it not not the
No
way it
other
should?
comorbidities is carried through to the other person. It is only
Okay.
the viruses, and you screen the blood for the HIV, hepatitis B, and hepatitis C. Apart from
Okay.
that, only bloodborne infections can be transmitted. Hypertension and blood sugars, diabetes
Blood sugar.
cannot be transmitted.
Okay.
I think
I
Dr.
think
Yu
Dr.
is
Philip, you
interested in the conversation that we're having about the success rate with plasma, and he wanted to beam in. We beam in and out just like we are on Star Wars.
You mean the plasmapheresis, where you take somebody who has the antibodies to COVID because they developed the IgG immunity, and you can take their plasma and you could IV that in somebody infected and give them the immunity, correct?
Yeah,
They're
correct.
recovering. They're not just immunity, they're recovering. So they're
Recovering.
taking the plasma and putting it in patients that are sick, and those patients are recovering.
Well, yeah, you're giving them the immune factors
Yeah.
to fight it. Yeah.
So
Same thing.
but they've had every one that they've done this to has been successful. So this has been good research. So
what is the mechanism? There must be some the growth factors or the umbilical cord blood or
no, it's just
hematopoietic stem cells must bind to the ACE2 receptor to block, to block the COVID virus to lock and key on the ACE2 receptor so they cannot replicate. Is that one of the mechanisms?
I don't. I think they're just doing blood transfusion, the plasma
No, I'm
transfusion.
asking the specific mechanism of that.
I don't know. One of you?
So in the convalescent plasma, this just like already you have been infected with those particular virus, and it's an antibody production. And once you have the antibody production with that virus, that antibody in the form of plasma can be transfused to the other patient after extraction from the positive patient. It can be transfused to those who are having the severe disease. So those antibodies will go and bind to the virus part, because virus has certain epitopes. We know that antigens has certain epitopes on the surface in the form of spike protein. The virus of COVID has spike proteins over its surface. Those antibodies which are produced in the positive patient, they go and bind to those epitopes and leading to neutralization process, thus decreasing the inflammation part.
So it'll bind to the spike proteins and it'll help
Yeah,
break down the cellular
yeah,
wall. So your
yeah,
your T cells, natural killer cells, could penetrate the wall and kill it, right?
yeah, absolutely.
Perfect. Yeah, that's awesome. Yeah.
So this is not a new concept. If you look at the IVIG, which we've been using it for last many years. So
It'll
IVIG
also
is
block the antigen so it cannot bind to the ACE2 receptor to your
absolutely,
cells.
absolutely, yeah,
Perfect.
absolutely,
Yeah.
yeah, absolutely.
Yeah.
So those who have those are the viruses who are circulating in our blood or in body. Those who have not been so far bind to the ACE receptors. So those are the
Yeah,
viruses
this
which
is
get.
the solution. This is a natural vaccine.
Yeah,
So
this
I
is a
don't
natural
understand the
vaccine.
pharmaceutical companies. They're like, "Oh, this doesn't work. It's voodoo. We need a
Could be
drug."
drug.
And
Yeah,
the vaccine has so many toxins in it. We were just
yeah,
talking
yeah,
mercury, thimerosal, which is formaldehyde,
yeah.
aluminum, aborted fetus parts. Very unethical. Yeah.
So this is what I told. For most of the countries have the youth, youngsters, and they are 60 to 70% are youngsters in every country. Like we talk about India, more than 70% are youth population. So those are the one. Even if it get infection, 95% will be getting the mild infections, and those who are going to recover it, that can form the part of the herd immunity. One. Number two, in the form of convalescent plasma, that can be used for the rest of the 30% population, those who are prone to get severe infection.
Yeah, they're
Third,
older. They have
the
weaker
older
immune
diabetes,
systems.
yeah,
They have comorbidities. Yeah.
comorbidities, yeah. The third one is the vaccine. God knows when vaccine will be coming to our scenario or market. That's a matter of debate so far. So till now we have two things, that is the our natural immunity will favor the herd immunity. Later on, second thing is the convalescent plasma.
Yeah, we really need to resist the vaccine agenda because autism is on the rise, because as vaccines are on the rise, the incidence of autism, so there's definitely a correlation. And now, they want to mandate this COVID-19 vaccine, which is, going to cause a lot of autoimmune disorders. So yeah, I think the convalescent plasma is the perfect solution because it's biology based. It's not chemical based. Yeah.
Yeah, it's a
You're
biological.
using the body's innate immune system, that it's already designed to do without putting these toxic chemicals inside of you. Yeah, perfect.
Yeah, one more benefit with the convalescent plasma is that is cell deficient. So we are just transfusing the plasma part. There is no cell in it. So no doubt of any getting into any kind of reaction or blood mediated transfusion reactions. So
No graft versus host
no
disease
graft
or
rejection or something like that. Any kind of
autoimmune.
immune
Nothing.
mediated reactions.
No vasovagal response. Great.
No the vagal response. So with one pack of plasma, patient can go into drastic response.
So when you draw the peripheral blood, do you have to spin it to separate the PRP and plasma? How do you do that?
Yeah, definitely the separators are there. These things are not done by us. They are the things which are done by the the blood